The story then used to say, if you want to die, go to Malindi District Hospital, because of that pathetic situation that was existing about 10 to 15 years ago.
But since the project came through the outreaches, these cases have been able to be diagnosed early, and of course they initiated treatment early enough.
Other problems we have in our community is around TB, tuberculosis. And it's because tuberculosis is something which not everybody actually knows the details about it.
This project provides first an opportunity to access quality care, both especially using diagnosis as an entry point. The kind of diagnosis you'll get in the laboratories that are being supported, you are not going to get them anywhere else.
With support from this project, we are able to do very many community outreaches, integrated outreaches, where we are able to offer all the services that a patient is expected to get from a dispensary.
The activities that have been carried out in this Somorosa are taking some preventive and also curative services to the people of Somorosa.
Before the program, we used to go to Fundisa for health services, but the program is having an outreach activities every month in Somorosa, and in those outreaches we've been able to have family planning, HIV testing, immunization, and child monitoring.
So when these community outreach people come down to the village, we call these people, they are told about the symptoms, the hazard and all that, and they wish they could come and test. But now, if they come here, it's good they have a center where they do the testing, they get the medicine at the same time, they see the doctor at the same place.
Diagnostic is a key issue in attending to any patient. So with the laboratory coming in, with the network coming in of the laboratories, it will be of great help to this community.
We looked at the public health laboratories as an area that had been neglected, yet it was so important in disease surveillance. And with these laboratories, the networking is enabling East Africa to know what is happening across the borders. And therefore, in terms of responding to epidemics, it is going to be much, much easier. And in tuberculosis, one of the most critical stages is to diagnose the disease. And a big challenge in tuberculosis control in Kenya and in the sub-Saharan region is actually the drug resistance tuberculosis. The diagnosis of TB has had a lot of challenges in the past. To confirm tuberculosis, it would take up to 6 weeks. But through this project, we've been able to bring in new equipment that is using the DNA to help in the diagnosis. This new equipment is known as the GeneXpert.
I said the project has brought a GeneXpert machine, which has enabled us to diagnose multi-drug resistant TB, tuberculosis, within a very short time. Initially, we had to take the samples to Nairobi, and it used to take us about 6 to 8 weeks to get the results. But currently, with the GeneXpert machine, we can get a diagnosis on the multi-drug resistant TB within about 2 hours, as we await confirmation from Nairobi. So we are able to start to refer the patient to areas of treatment. So that prevents the spread of TB. Initially, they had to wait for 6 to 8 weeks. So we used to lose, most of the time we were not able to trace the patients because they'd migrate or move to a different location.
The coming of this project and the construction of the new laboratory with improved services and networking will be of great help to the community.